on. The link will be posted for the Google form if you're part of the main organization at the end, and we'll have it open for about an hour, I think we decided. And after that, it'll be closed. And we'll talk about that again at the end of the live stream. But we're going to wait a little bit just for people to join. Okay, I think they got the, okay, it's working. It takes a few minutes for people to actually hear us.
That's the problem. Yeah, I think it's delayed.
It's the stream delay. Okay, cool.
Okay, we got 100 people. You want to wait for 5 minutes, Rohan?
Oh, the chat isn't working.
It's not working.
Oh, it's
I see a lot of people commenting. Yeah, I even see some kids from the Woodlands High School.
Okay.
Nice, okay.
I have someone right now messaging me. Okay, it's working now.
There we go. Good, okay. Let me just leave the chat.
It should be working now for those who DM'd us. And I'm just asking, is it working now? Okay, it's working now. Cool. And it says that they played a video, but...
Oh.
All right. I think I'm just going to make an Instagram quickly, just saying we are live right now. So we're just kind of giving it a little bit just for everyone to join. And it is 5:03.
Okay. Let's see.
Link tree. Numbers.
How many people do we have?
1 service hour.
Rohan, how many people are watching us? I can't see.
134 it says right now.
Okay. I was expecting a lot more.
Yeah, I'm hoping. I'm not sure if it's because of time.
Right. Yeah, I thought
some people are asking. We're just waiting on Dr. Soufer. He's gonna come back, and then this will all start. So yeah. Just keep tight, I guess.
Let me tell them.
I'm waiting for you. So you say,
hey, are you ready, Dr. Soufer?
Yeah, I've been waiting. You guys said wait, so I waited.
Yeah, I wanted to wait one more minute. Let's see if we get more people. We have, what is it, Rohan?
146, 148. I think they're just joining a few minutes.
What's the number you guys want anyway?
We're looking for around expected like 500. But you know, we're just glad that people still showed up. So
I'm so sorry I disappointed you. I need more people.
It's all good.
Let's just wait for a little more, for more people.
I don't mind waiting a few more minutes. Just don't worry about it.
Thank you. Okay.
And the post that I just put up, I'll be archiving soon.
So is this recorded?
No, not yet.
Well, I don't understand. Like, can someone record this and put this on YouTube?
Yeah. I think the live will be saved on to YouTube once it's done, and then we'll have the recording on Instagram.
All right.
Oh, seriously, 500 people. I'm just reading out the comments. Yeah, I mean, we haven't started recording it. I think once you start the lecture, we'll press record.
I don't think you should worry about a number, man.
Yeah, I think we should just go ahead and get started.
Okay. Okay.
I just think that you have to be practical. People need to get on the phone, on the phone. I mean, they got to get online. So just chill and just wait a few minutes.
All right.
Okay.
Okay. Well, I think we're ready.
All right.
Dr. Soufer.
Gonzalo. Hi.
I mean, like, you can now start.
My name's Bob Soufer. I have the pleasure of sharing some time with you. I was asked by Gonzalo Ramirez and Color for Coats to share my experience of my journey of how I wound up doing what I'm doing. And who I am is a cardiologist, professor of medicine at Yale University, and I'm vice chair for clinical research of the Department of Medicine and associate chair of medicine for faculty development at the Associated Hospital, the VA, which the faculty are the same at both places. So I thought I would start by advancing the next slide. So this is me. I guess that's 1992. And I got one of the first 10 PET scanners with a medical cyclotron in the world. It was only 5 in the United States. And because I wanted to understand what's going on inside someone's body, the functioning of it, but really, how did I get there? Like, what was it that made that guy, and now this guy that's talking to you? And it's that woman, my mother. So that's my son, Aaron. That's Eddie, and that's Jessica, married to Aaron. So my mom had mitral stenosis when she was young. In Bronx Hospital, they gave her mitral valvuloplasty, which is basically putting a finger into the valve to open it up. And here she is 6 months before she died. But I remember when I was a kid, I would go to hospitals with my bicycle. I'd just be by the emergency room, seeing people come in and out. The whole drama of it was like, could I really help? So that's really, what put it together. This is an echocardiogram. This is the left atrium. This is the ventricle. It's upside down. So the apex is here. So when it's in the chest, it looks like this, right? But this is the top of it. This is the base. This is where the apex is. Put your hand over it. But when you're looking at it here, they did it upside down. If you see here, it should be going this way, but that blue coming back is this red, this is little blood coming back, but here it's very tight, mitral stenosis, and it's very, very, the sonogram is showing the high red that it's really, really of a fast rate. So as it turns out, when I went to Yale, I went to all city hospitals. I wasn't really an Ivy League fan, but I was very interested in, there were Haitian patients dying and their hearts were functioning normally. And I knew there was this guy at Yale, and this is the high volume in the ventricle. It empties, it goes down. But when it's filling, do you notice that it's kind of shifting to the right? It just goes straight up. And I noticed that. And I hated math. I wanted to be a doctor. I hated math. But I knew enough about calculus that I got to get someone to tell me what the slope of that is. And that turned out to be diastolic heart failure, which is what my mother had in addition to mitral stenosis. And it was that knowledge that my mother, that picture was 6 months before she died. She should have died in a month, but we used some special techniques. And in the field that I actually investigated, my son got married. This is my older son. He's a musician writer. And there she is. So, that was kind of personal, but more things happened from there. This, because we're talking about valvular disease, I want to show you this. This is mitral regurgitation. You see how that redundant, this is the atrium ventricle Blood should be going this way, but it's going the opposite way. And we measure that. But there's something more interesting about that. When you look over here, that's the aortic valve. You see how white it is? It's very, very dense. So there's a stenosis here of the aorta. And many hospitals don't even do invasive catheterization. Just based on the high quality echo, they could measure the envelope of the velocity and come up with a valve area. So here the valve area is 0.65. Normal aortic valve is 1.5 to 2. Critical is less than 1. And then we do surgery. So here they are taking the valve out. I'm showing you a patient from diagnosis to treatment. They take the valve out and they put in a new one. They could also redo the aortic root with Dacron. This is taken out of a patient with a dilated aortic arch and root, and they could put in a Dacron here. There's two types of doctors. So the doctors in cardiology that diagnose it, like I do, we do all the imaging, and then we take it to either an invasive cardiologist who can do a stent or can do a valve, or we have to open up the heart in certain situations to have a surgeon do it. So there's medical cardiologists and there's thoracic surgeons who specialize in cardiothoracic surgery. The other aspect of cardiology is coronary artery disease. So this is a catheter in left main coronary artery. And what you see here is this is the left anterior descending artery, but over here you see the circumflex is narrowed. It's narrowed over there too. Now, if that becomes worse and there's a plaque and it ruptures and there's a clot, you get a heart attack. And here, oops. And here you see a scar and this is epicardial fat. That's the leading killer. If we go back to this guy, I was astounded by the fact after diastolic heart failure that, again, because I was a doctor seeing patients, that patients who got chest pain because they got pissed off or angry were kind of dismissed because they had normal exercise tests. And they are repeatedly going back and back into the emergency room, but because there's no specific treatment for it, people don't want to address it generally. So anger and acute coronary syndrome goes all the way back to Celsus. I'll give you 6 other examples. Fear and anger in any other state of mind may often be apt to excite the pulse. So that's demand. And here is a slide that shows you this. Of several thousand patients coming into Beth Israel Hospital, Boston, 20% had an episode of anger within 2 hours of their heart attack. And this is what I developed with others to try to explain. And this has to do when we talk about people of any minority or any who are distinguished and are humiliated and their dignity's taken away, you get angry. And there's ways of dealing with it, but it does pay a toll in 20% of the incidents here. I've done a lot of research in this and I can't really explain all of it. There's a lot to it, but this is an interesting one. This is ejection fraction, mobile ejection fraction. You do an interview, it's basically an interview to anger somebody. Their ejection fraction drops. And even it took walking to get it back. Exercise, whereas exercise usually would make it worse because it's a different mechanism. I have another one of a patient waiting at the elevator at the VA. He was so upset that while he's waiting for the elevator, his EF went all the way down to here. I couldn't find the slide. So this thing we're talking about, the way we treat each other, is very, very important. It does harm. And you have some control of trying to shape that and understand it. I study it. So what I did is that PET scanner, what we did is we took patients at baseline, and then I developed a mathematical stressor, counted serial sevens back from 100. And we made sure that phenomenologically, the experience of each patient that got one wrong within each 10. And then we took the stimulated scan, minus it from the baseline, and we have what's hyperactivated. And this is like P less than 0.00001. It's very, very. And what does it show? The areas here of emotion and cognition, it's called the limbic area, you know, where people have PTSD, people get angry. It's hyperactivated. And here we have a scan. Apex is at the top, at peak mental stress. There's no flow there. Orange is low, yellow to white is high or normal. It starts coming back when you let them, when they come back at rest. And this is at the same time. We develop a test where we do it at the same time. So now we develop this neurocardiac interaction. And then you do it in people of color. And then you do it in people with a poor education. You do it in men, you do it in women, and you see how different cohorts, different populations think, and you tie it to biology. And then you get a target to treat it. Not the psychosocial trigger that of an insult. That could be done by cognitive behavior therapy and maturity. But understanding what happens is very important for health and disease as a physician, because I'm not a counselor. I'm here taking them like, imagine a war. I'm in the hospital when they're coming in to fix them. So we have to find a target. And one very smart guy, his name was Cahill, it was published in New England Journal, took patients who were coming from accidents in the San Francisco emergency room. And he gave half of them a beta blocker, which blocks epinephrine, which they think consolidates the fearful memories. And he gave the other half, didn't give them epinephrine, and he matched for the degree of accident. The amount of PTSD was much higher in those who didn't get the beta block. So there's a lot of putative evidence that could be treatment. So, you know, I did a lot of work in this, and this is what you could all do. It's a lot of fun. It is hard, but it's worth it. Here, I came up with a model. This is from a grant where it shows that when someone gets upset, there is a combination of limbic to prefrontal cortex hyperactivation. Prefrontal cortex in women actually activates in a different way and gives them more of an evaluative component over men. Women use more of their brain than men. They use both sides of their brain. Men use only one side. Sorry, guys, it's true. The other half of their brain. So it's like, there are differences. So here, what happens is the prefrontal cortex is responsible for keeping the slow part, the parasympathetic, going, but it gets deactivated. And that's heart rate variability goes down, which then causes inflammation to go up, and the anti-inflammation chemicals, nitric oxide, which vasodilate the heart, to go down. ET1 is a vasoconstrictor, and the limbic system is activated, causing norepinephrine to go down. At the same time, what counteracts it is being deactivated. Isn't that something? So when you get angry, when someone gets angry, you try to calm them down, they get even angrier. It's kind of like that. They have nothing to stop them, so you have to just get away. That's a metaphor of this. That you get the limbic system. What happens is that has a lot of things in it. It doesn't just cause norepinephrine. The hippocampus causes perspective. Like when you have PTSD, you have a lot of glucocorticoids. Your hippocampal dendrites. I published this with Doug Bremner. they actually shrink. And so let's say someone got mauled by a bear and they have constant stress, they wouldn't be able to distinguish a bear in the woods versus a bear in the zoo. They lose perspective. So some of the crazy behavior is people losing perspective because they actually have chronic stress. All right. What did I say next? Oh, so this is me in Australia. I'm a motorcyclist and I used to go cross country. I used to talk to a lot of people. And I have a great life. I had a lot of issues growing up, meaning finding out who I am. But the medicine thing, helping other people, there's just nothing like it in the world. Whatever you do, you don't have to be a doctor. Just helping other people helps me and helps other people. And I don't think it's so important to go to the best schools. It's important to go to school and do the best you can. And it's important to have dignity and to try to understand other people. I'm going to leave you with a few words and then I'll take some questions. There's a guy, Will Rogers. Do people remember Grapes of Wrath? There were Americans called Okies who were mistreated. They're in the Dust Bowl. They went to California and they had PTSD. Will Rogers is from that era, and he wrote some really interesting things that I think about. He says, common sense ain't common. Good judgment comes from experience, and a lot of that comes from bad judgment. Another way to say it is, how you know you're going to get any better unless you make any mistakes. Don't let yesterday take up too much of today. When you find yourself in a hole, quit digging. Know when you're making a mistake. It takes a lifetime to build a good reputation, but you can lose it in a minute. We've seen that in the political scene lately. People's minds are changed through observation, not through argument. So be who you want to be. That's all I got to say, and I'll be willing to take questions.
Okay, let's see if we got any questions. The live video, it's kind of delayed. So they're just getting to the part where you put that slide. So they haven't asked any questions yet.
Okay.
The one that says it takes lifetime to build a good reputation, but you can lose it in any minute. That one is very, very true. And I've seen it many times. And just like you said a lot in politics lately. Okay, so someone asks, how do you know you wanted to do cardio?
Well, I was actually interested in everything. I loved learning. I was going to do the brain, but I actually wound up doing it. I trained myself and when I went to Yale and training, I really was able to carve out time and take another fellowship in that. And the heart, however, is moving. At the same time, there's electricity, there's plumbing, and it's the central warehouse that supplies all of the oxygen to the other organs, and it's connected to the lungs in ways that I found it, so much can go wrong with it. The electrical activity can be non-coordinated to the mechanical contraction. The arteries, get fat in it, and somehow some people make it and others don't. Now we know it's not how narrow it is. It's other things like the plaque and how much inflammation there is on it. So the answer to your question is it's the complexity of it. And if you've ever seen a heart beating, it's something that the imaging of it, because I knew I don't like cutting, I could do it. I've done it. I don't like it. And I love the imaging, the heart moving was just very beautiful to me, and I could figure it out.
Mm-hmm.
So that's the answer.
Pretty interesting. Okay, so
we have another question. Is neuroscience seen in cardiology commonly?
No. It was like, to do this work, if I send it to a neuro journal, they say, well, who's this cardiologist? And if I send cardiology journals, they say, what is this? This is too uncommon of a thing. They don't really have an open mind.
Mm-hmm.
So it takes that part that I was talking about, knowing yourself. I know that if I really believe in something, I'm going to get it done.
Yeah.
And so I just didn't, that's what I thought about myself, and it kind of became that way. Some of these questions are hard to answer, but you got to do what you love. And I was like I was not totally happy about becoming a doctor, because my parents really wanted me to do the immigrant thing, and you got to do better. My father was a doctor, so at least I had to be a doctor, if not, whatever that is above it. And so I was a musician, so and a photographer, and so now I do that. But once I did it, I had to do something I love to do. And it's not easy, what I'm saying, to find, but it's not hard, and you should not compromise, is what I'm saying. And you don't get it right away. You have to work at it. You have to see it in the future, you don't get it right away.
And one more thing, a lot of people are asking about what it took for you to be a cardiologist and what it took for you to be where you are today. From schooling to, education to all that.
So what it takes is the facing fear, and because when I was applying, there was only one spot. 300 people applied for one spot, and you had to get an immaculate A to get in. And it was just, and if you have one teacher that doesn't like you, and they're just crappy to you, or TA in a chemistry class, just doesn't like you. They can't explain that you really meant this when you wrote the essay. And so, and they mark you down. That I hated, but I sort of gamed it. I said, well, I got to do this as fast as possible, because I want to go back and play guitar. But I took summer courses, you see, and that put some of the pressure off. But I did it in 2.5 years, and you have to do it at good places. In other words, you can't just take a summer course anywhere. I mean, I went to St. John's University, my summer courses, and it was not such a elite place, but it was, it's a very good school. People, what you think is good and what educators think are good might differ. Like, I'm a professional educator. I know good schools, and I know where people are coming from. It doesn't necessarily matter where they rank. So the point I'm trying to make is that it takes, this constant thing of delayed gratification. You have to get really good marks at school, and then you study for these inane exams, MCATs, which, the languaging of it to screw you up sometimes on questions and the way it is, and you have to score a particular score, just like you do for your exams for college. Then you get into medical school, and it's really hard work. And be honest, I mean, you just constantly study, and everybody who's made it is as smart as you are, so you can't slack anymore and still, kind of rise. You just can't. You got to be on your game. I went to a pass-fail school, but then they go, "Did you get honors?" So, you know, you have to get the honors. And then you go to medical school, and but I say it's tough, but you know, you're learning a lot, and you're part of a group of people that if you do a good job, you got a good chance of being respected, you know. And if you do a good job, you can really help people and learn. And being a doctor, you know, the great thing about it, just why I'm telling you how much harder it is, that you could do anything. You could do epidemiology. You could not just do radiology and stuff like that. You can go into computer technology, medical informatics. There's so much, and there is demand, and you have a good security. I mean, you know, I don't know how many doctors, except for maybe surgeons or plastic surgeons, are really rich. But you know, you have security, and then from there, we said college. You get into medical school. That's 4 years of college, 4 years in medical school, and then you choose surgery or medicine, and that's 3 years. And then you choose a subspecialty, let's say cardiology, that's 2 to 3 years. But then you say, I want to be a nuclear cardiologist, it's another year. Or you say, I want to do electrophysiology, it might be another year or two. Or you say, I want to do stent placement, interventional cardiology, that's another 2 years. But, you know, if it's important to you, you could find a job wherever you want, probably. You know, start off with you know, my son that got married, and he went down to Tennessee, and, you know, he decided to go into clinical practice, and, you know, he's making more money than I am the first year. And I've been like a, you know, well-known doctor in academics, but I make really good money. But, you know, you can go into practice and make, you know, upwards of $600,000. But if you make between $200,000 and $300,000 steady your whole life, you don't have bad years, and it goes up a little bit more after that, and you're teaching people and you're creating new knowledge, you know, you make less money. But for me, because of who I am, I couldn't see patients every day, and because usually they have the same thing. They're in groups, you know, atrial fibrillation, and then you refer them, and there's a pattern. There is a very, and I do it part-time, but to do it all the time, as opposed to teaching young people and trying to, you know, the research I showed you that I did, that comes from here. You know, no one can take that away from me. You know, there's no boss that can take that away from me. You know, there's no one who could take that away from me, because I created that. So that is a big deal. And I rather make less money and do that, but it's tough, you know, to get to be a professor and stuff like that.
Right. Yeah.
But you all have it. You all have what it takes, you know. There's a lot of professors everywhere. And
right.
Mm-hmm. And we'll take like one more question, but I feel like a lot of the questions in the chat are asking, you know, how during, you know, your school and all for, you know, pre-med and med, you know, what were the hardest challenges that you faced, and what inspired you to keep on going on this path? Because I feel like a lot of people, especially, you know, in the chat, know that, you know, med school isn't an easy thing to go through, and they want to know, you know, what has inspired you, and, you know, what really kept you going in terms of, you know, stress and all that. And yeah.
So if you're the type of person that something happens to somebody and you're the first one there and you really care about them and you want to help them, you're that type of person, and that's the type of person I think I am, and people say I am, then I want to help people. I have no choice but to do something that helps people. So, and now I have a certain intellect, right? So I can be a nurse, I could be a physician assistant, I could be an APRN, and I could be a doctor. So I like challenges. I don't like the easy. I want to do the best So I chose that, but you could choose the other things. And there's a lot of people who could go to medical school who do other things, it's not like it's second rate, or there's a lot of people, who don't want to do that amount of work. But, I wanted to get smarter. I wanted to improve my whole life. So I chose to do something around people who question. You just can't say whatever you want at a university at Yale. I'm a professor and a lot of them do, but it's not right. But people question you. And so I'm working. You're asking me what inspired me. What inspired me is to be amongst the best. And so to be amongst the best, I had to do my best. And it's hard. And, I'm not saying I didn't want to be like everybody else. I want to be like everybody else, but I want to be me and with everybody else. And me is someone who wants to challenge myself. I want to be around people who say, why did you say that? Why do you say that?
Mm-hmm.
I like this question a lot. Someone asked, what was the hardest challenge that you have done, that you have faced in your career?
Oh, there's so many, and they build on each other. No, I know it's a good question. Okay. It's hard for me to answer in a way that is satisfying, but I'll try. I have to clump certain assumptions so that would happen. Fear of failure is a big deal. I don't want to fail. When you say you want to be the best, that's tough. That's a lot of work. So that's a challenge. Like, to be the best is a real challenge. And what does that mean? That means to do good work, to do good, honest work. Like, not to have your ego in it, to be not like to have the most papers or to, I'm not talking about that. I'm talking about to be honest, to have integrity. Like being a doctor, people hold you to that standard, and I think the hardest thing for me was when I was doing diastolic heart failure. No one wanted to work with me because it was new, and now it's a big deal. When I did neurocardiac interaction, no one wanted to work with me, and my promotions were, even though I did all this stuff at Yale, they're very conservative. So I had to just do what I wanted to do, even though people thought that I was risking my career, and that was really scary.
And one last question before we move on to more about, how this relates to our organization and our mission. What would you, and I'm trying to look, what would you recommend students to do to, stand out in medical schools, and what is your advice to them, and how to stand out and all?
So what many people do is do research with somebody. And if that person has pull, they will stand out and help them to the next step. So that's a standard way that everybody does. So I can say that. But what impresses me are people that have broad experience in life and who've thought about things, people who care. Like, I think, and how do you show you care? By volunteering and doing things. There's an incongruity, though, is there not? Like standing out by doing something, but you're getting something for it. You're standing out to go to medical school. So it's a really difficult thing to say. So, I think you have to think if you really want to be a doctor, I mean, you have to really think, like, is this what you really want to do? And many people say it, but I think that you got to want to help people, and you want to help people. And if you're going to help people and be part of that organization, definitely being an MD is on top. If you're a PhD or a psychologist, in terms of resources given by the hospital and third-party payers, you know, you want to become an MD. Psychologists don't write scripts, you know, psychiatrists do, but psychiatrists don't talk to patients, unfortunately, and psychologists do, you know, so it's all screwed up. But still, MDs have the power. So I think I'm trying to appeal to, you know, the question was, you know, how do you stand out? I think you have to really try to think if you want to do this, because becoming a doctor, you're part of a group of people with high responsibility. And when you're not a good doctor, you stand out from the other doctors. And many doctors may stand out because they don't really want to do it. So I think you really have to spend time with a doctor. If you have a role model, you know, talk to them, ask them, and shadow them. See if you really want to do that. And I think the way you stand out is by understanding why you want to do it and do things that reflect that reason.
Okay. And I think we're going to move on from the questions for now and kind of talk more about, you know, how this relates to our organization and our mission. And then we'll have at the end another round to ask questions. So Gonzalo, did you want to take it off? And
I stopped sharing, right? I don't have to share anymore.
Yeah. Oh, I think you're on mute.
Oh, really?
No, it's me. I was on mute. Okay, there we go. Right. Well, Dr. Soufer,
Yes.
I know you've talked a lot about how we have to develop character and kind of have a mission in life. That way we can help others, especially how you emphasize the develop character part, right?
Mm-hmm.
I'm going to ask you, since there's a lot of, or there has been a lot of racism going on, not only in the country, but in the whole world and in our society, all the way from the beginning. And I know you've suffered racism like I have, and a lot of people have. Relating it to how could you say what can we do to fight against racism and empower ourselves and try to change society?
Wow, that's a big question. You're asking me more than just your personal stance on it, like how to organize people to deal with it.
I mean, I know you stand for what you believe in. I do the same thing, and I don't care what the rest of the people think about it. But what can we do as a society or as a group of young high schoolers to, you know, fight against this type of issues that we have in the world?
All right. Well, so there's a transformation in education, understanding these things. Like, for instance, Yale. So in the medical school, when the COVID was starting, we would have COVID AM meetings with 30 people, and there'd be the novel treatment group, there'd be the MICU, and it's all people of color doing that. Okay. So in the medical school, we're very much integrated, but you're asking earlier than that, but let me just make my point. In the undergraduate school, they do a great job in having diversity, but the complaint is that the professors are all white males because they can't retain professors of color because there is unconscious bias, right? So one intermediation for someone who's vulnerable, someone who may be queer, someone of color, you know, one intermediation on behalf of someone like that doesn't necessarily mean that the people who are still there, the faculty, really think that's a positive, but the administration doesn't care because they're just getting a diverse faculty, but the faculty don't stay. So my point is that everyone's saying these things and there's all this hate, but it's because you're going to be taking over the world soon. You know what I mean? It's like, what are you worried about? I mean, you know, you're going to, I mean, I understand it sucks. I mean, it's painful, you know, and my racism was different. You know, I'm a Jew. I just look like all the other white people until they find out I'm a Jew and they think I have lasers and I rule the world, you know, so I have to put up with that. But, you know, but isn't that ridiculous? So either you'll hate it because you have special powers and you're really good with stuff, or they hate you because they think you're, you know, don't fit into society and are not, you know, good enough. So either you're too good or you're not too. So people are going to find a reason for anything, you know. So they didn't let Jews into medical school until 1970. Many of them, you know, couldn't do what they love to do. And believe me, if you had a Jewish mother and you don't become a doctor, they get very pissed. So they had to deal with that. Okay. And so it's like, you know, but that racism is different than this. But if you are a person of color or you speak Spanish, you know, you don't, or you're poor and kind of look funny. I mean, you know, you get a lot of crap, you know, and, or if you empathize with people like that, you know, it's like, you know, what we have in medicine is, okay, so I have a friend, she's a Black doctor. Do you know how many times we go into the room and the patient says, sorry, I'm not finished with my food yet? And she is like a really good doctor. And she's the wife of the chair of medicine, who's my best friend, one of my best friends, and he's Haitian. So we have made great strides and we have courses now and we make people aware of that. And so I think, you know, from my end, you've already, it's winning. You know, it's like, you know, we don't not take, you know, we still have to be more diverse. You know, we have now 50% of our women are associate professors, and now they're going up the pipeline, be 50% women, full professors. But the world is yours, and this is tough, but you have to keep your dignity personally and as people. So getting together to fight hate, which I never really have, I just talk about it with people. I'm not shy talking about it, but I haven't really organized because I was studying so much just to get to become a doctor. I mean, it's like, you know, you give up a lot of stuff, you know, but I was really, really taken with Martin Luther King. I would read his speeches because, man, the guy is smart. And I'm not just saying it. I mean, he's inspiring. And I learned a lot from him about human dignity, what we're talking about now, and his sense of containment. Like, you don't screw with people like that. If they're black, white, purple, doesn't matter, you know, and, you know, so someone might say, well, that's a good one. You know, that's what you hear most of the time. If you have dignity in other people of other ethnic cohorts like you, and that's an insult. But you could say something, or you can wait for the right time to try to convince someone of their ways. But I think, to answer your question, time is going to take care of it.
Time will take care of racism and inequality.
Well, no. Well, I think there's going to be hate, but the power is being distributed now amongst more than just white men and women. There's no doubt about it. I mean, it's just happening. And in the medical schools and in the graduate schools, you know, there's a lot of diversity. And so I'm at Yale and I see it all the time. You know, we have an American Indian woman, head of surgery, a Haitian man, head of medicine. you know, that's a big deal. That wouldn't have happened 10, 15 years ago.
I don't
So that's a big deal. So I think that the personal journey is much more difficult. And I think that the forces are much greater than what I can put my arms around now here. I mean, you know, I was during the time of Watergate where Republicans said to a Republican president, you know, it's not good for you, man. You just got to step down. Here, it's like he has a basic cult of personality here of many people. I don't know if it's really truly 70, you know, diehards, but there's always been 20, 30% of Americans who are very, very hawkish about being pure from America. And that's never going to change. And they've been given a voice, and I think they've influenced more people. But I think over time, you know, the emperor has no clothes, and hopefully present administration will make great strides to decrease the fear that the people have. And it's got to get a little bit better because it can't get much worse. It is pretty bad. But I don't think it's time to panic. I think it's time to be proud. You know, why do you think someone is going to be coming and doing what you said about someone, you know, making a point that they're part of the another organization and they're, because you only do that if you're scared. So then you become scared. So what's the point?
Right. Yeah.
Now, if someone's coming with you with a gun and an axe, you just have to run. That's my advice. But you don't want to get to that point, right? You don't want to get to that point. But no, little like, bull, you know, someone saying shit. I mean, it's like, so what? Well, the so what is that if they keep doing it and they're abusive and they create a hostile atmosphere, that's when you have to do something, right? That's when you have to do something. But if it's a one-on-one, someone's calling me a dirty Jew, it's like, come on, you know, really? You know, I feel bad because there's a person like that there saying that makes me feel bad. That is true, but it doesn't change anything. And there's loads of people, right?
So one thing that, and I'm sorry to interrupt you a little bit, but before we do wrap up, there was one question that we did want to ask you. And it's more about the suicide rate of physicians is obviously extremely concerning. Why is this? And should anyone watching this be concerned?
Oh, well.
We're kind of switching topics a little bit to something a little bit different, more mental health wise. And
hold on for a second. Some light. I think that, okay, so the surveys are that actually nurses are affected more because they're more frontline. So there's about 40% of nurses have some sort of stress or anxiety disorder since COVID, and 30% of doctors. And the reason for that is because on top of the regular normal weirdness of like, do I have my mask on? And, oh, were those gloves on the car floor new, or do I have to put on other ones? You know, that sort of weirdness. You know, I have to make a decision on one of my faculty because someone's dying and the wife doesn't have a phone and she needs to say goodbye to him, and we have to drive and give her a phone. You know, that's stressful. I have loads of story. I mean, I know 5 people I know have died. I know doctors who are so heroic and they've had COVID and they've had strokes in their office and they have lesions in their brain. So that's why I get stressed out. So that's what that's about, I think. And yeah, I would be concerned that if you are worried about that, you know, become a doctor, but don't do direct patient care like that. And you could help in other ways. But it's a concern. I mean, do you know that the suicide rate amongst the Army is like 2 to 3 times the normal population? like every hour. I mean, it's really horrible. Society, there's a lot of stress, you know, and there's a lot of confusion. We haven't had a cohesive leadership politically. We have a very, very diverse country. And so I do think that, to answer the question, is there's a high suicide rate very often in professions such as these.
Mm-hmm. And one thing before we kind of
You keep saying that. This will be the last one. Okay.
Hey, Dr. Soufer,
Yeah.
what time do you have to go?
I don't know. I'm fine. You can keep asking me questions. I'm just worried about the lighting here. Hold on.
You tell us. If you have to tell us and we cut it off, okay?
Everybody's left me, all right?
Okay.
Okay. And I'm looking through the chat right now because we're trying to get to as many questions as possible. And so obviously if we don't have time to answer your question, we're really sorry. But one thing that we did want to ask you, Dr. Soufer, is what is some, just, before you go with us today, what is some advice you give to high schoolers who want to become a doctor and go through medical school and all?
I would expose myself to it. I would see if you like it. The smell of betadine, the sort of, hustle and bustle of the environment of a hospital. And if you know a nurse, if you know a doctor, I would approach them and say, is there any way I could hang out and just get a sense of what's going on?
Yeah.
Mm-hmm.
Right. Yeah. I mean, a lot of kids that I know, a lot of kids sign up for internships to be local volunteers at hospitals to kind of get a sense of what the environment is like, the big moving, how hospitals, they're always moving.
Yeah, I know.
Exactly. So they all tried out, and I even tried out myself. And right when we were actually going to go and be interns, they canceled them because we had the pandemic. So now what we try to do to get a big sense of it is virtual shadowing, which is not the best way, but I mean, at least you get a one-on-one experience in talking to the physician.
I think by the fall, we'll be able to do that stuff in person.
You think by the fall we'll be back?
Well, I don't know about Texas, man. That's its own country.
Mm-hmm.
Yeah, I don't think.
I really don't know. That Texas has been screwed like this, the Lone Star State. Lone Star.
Yeah, it's the Lone Star.
It's so very lonely. Are your electric bills really high?
Yeah, they're probably gonna be very high. But they were blaming it the power.
Yeah, I know.
On the wind turbines.
Yeah. So what's the next questions?
So, actually unrelated note, but a lot of people in the chat are saying how much they love your house.
What is
how much they love your house?
I love it too, man.
They were saying, give me a house tour.
Well, this is I face the west, and I see that's facing San Francisco.
Mm-hmm.
And then I have I've actually have my own beach over there. And you see, it's part of a public beach. And because it's part of a public beach and I like people, I got a good deal on this house. And I meet a lot of cool people. And I meet a lot of people who don't like Jews. And they go, you're a Jew? They're like, oh, you mean I'm a good one? So, I get that. Oh, let me turn on the lights here. So I'm actually.
And while we're waiting, we did put in the comments the form, and I'll put it again, but it does close in an hour, so please be sure to sign that if you're right now on the live stream. If anyone is not in it, they will not get access to it.
Hey,
all right.
People are saying that they love your house. They're saying, adopt me, please. I love this guy, LMAO. Oh, I love Jews. That's awesome.
You love Jews. I love it. So I have a big camera collection. So, and a guy's coming because I'm really into motorcycles and I want to get a new BMW motorcycle. So I bought some stuff and it's worth more money now than I bought it. So there's a lot, but this is the house. This is like the fireplace here. And I'm really into hi-fi stereo and I'm a guitarist. So I got these guitars here.
I've heard about the stereo before.
Oh, that's right. That was a different one. And then that's basically it. And, you know, I collect cameras. So I got a lot of these here. And I do a lot of, I put up pictures, my photos, stuff. You want to see something cool?
Sure.
This is the bus stop in New York City of the people waiting for the bus. And this is like a portrait of it. And this is why people from New York have more tolerance, because when you go to the bus stop, and this is like what, 1980s, this is what you see. See people of all colors waiting on the bus, and they're looking at you like nasty and stuff like that, but you can tell they're really not nasty. They're okay. So, you know, I think if you're brought up in an urban environment, you get used to people. You know, you get the people, you're comfortable with a lot of different people. You know, Spike Lee's, you know, Do the Right Thing, that movie was true in Brooklyn. So there's still racism, you know, there's still, but it's better and it's honest. You know, it's kind of like, it's not like the type of racism where you're worried about your physical health as much as your feelings are getting hurt.
Yeah. You know, people are saying,
What are they saying now?
they want to see you back. They want you back. They want more sessions with you. And Dr. Soufer is my new favorite. You're so cool. And then someone even said, someone said, screw it. Show me every single movie you have made. The cameras though, wow. They like you a lot, Dr. Soufer.
Well, I like people a lot.
Right. Dr. Soufer, I had a question that said, the medical field is such a scary field that comes with many problems. Are the risks worth taking?
Well, that's a longer conversation. The risks that we're talking about, that's where you have to know yourself, right? So, like, there's people on this that I've just, of the 6 people in front of me, there are people that are going to be successful. One's going to be like a jovial, you know, Gonzalo. One's going to be a more strategic Rohan, you know, and so, and other people, this is all positive because everybody gets success in a different way. Really, really, I've had to be strategic, you know, so, and there's listeners who are, you know, usually like the women, like know more of what's going on and they listen. And they have different pressures of being a woman is like just everything is harder being a woman, just like everything. And that's true. And I'm not just saying that to like warm up a woman, you know, it's just like, it's true. And I didn't believe it my whole life until I actually saw it. And then women of color, holy shit. It's bad. I mean, and I've been with a woman for 20 years, a woman of color. We're not together anymore. And she was quite a bit younger than me, but she was like a little math genius. And I saw it. I lived with her for 20 years. You know, I saw it, like being overly friendly and being not as unfriendly and just the whole, all of it. And, you know, but you know, it's going to build you up.
Mm-hmm.
Mm-hmm.
And everybody gets punched in the stomach. Everybody. Some get punched more and some people don't give a shit about you.
Yeah.
And it's all there, you know,
Mm-hmm.
but many people do. I do. And there's others like me. There's many people like me, many. So that's what you've got to tap into. There's many. And diversity and acceptance, equity, and belonging to others. There's no other more important thing in the world. And I think that we have to level the playing field for people, but it's not. It's harder for many people of color. Like because there's people of color who, know how to game the system also and come from, they've got legacies. Now we're in the second and third generation. It's like, then there are different cohorts who are vulnerable, Hispanic, color, competing with each other. Then there's the Asians who they're saying don't count because there's so many of them, they don't count as a minority. So, kind of all of this is a little bit like unfair. It's unfair to exclude Jamaican children from the spelling bee because they win every year. No one cares about that. So you didn't know about that. A lot of people don't know about your suffering.
Mm-hmm.
So I guess the question is, how do you tell them? And I guess that's the dignity part. I just don't know how successful I've been at that. I'm mature now, but I had to grow up, and I just don't know really how to explain, except that I use creativity. Like I write songs, I take pictures, I when I play with kids, I get down on the floor with them, it's like, get into life. That's what I like, and I try to practice it. And there are people that judge me for being too disinhibited.
Mm-hmm.
And sometimes I am. Sometimes I cross that line of, someone's over there, and if you lean in a little bit too much, they're going like, hey, whoa. Right. And they're right. I don't mind that. I don't mind adjusting that. That's so what? That doesn't kill me.
Mm-hmm.
Now,
Yeah.
if someone says, I don't like you use your hands too much when you talk, well, I'm not going to talk like that. So, I'm trying to give you an idea of like what you can pick and choose. You could choose yourself. This is what I'm saying.
Someone asked, since anger can lead to heart attacks, do you think the health of people of color is correlated to the social climate?
Oh, absolutely. So that data that I showed you, if we do it in Black women, there's a great, what's her name? It'll come to me. She did the study in Atlanta. And the most disenfranchised, who are the Black women in Atlanta, have the highest vulnerability to stress and heart attacks, particularly if they're postmenopausal, men and women. Also, and this is very important for this study, there's a study that you might want to look at, Whitehall study, Lancet. It's like 30 years ago. And this changed my life. This guy does this study of hundreds of thousands of patients, finds that the ones at the bottom of the ladder have the most heart disease. The ones who have they have more job strain, they have less control over their environment.
Mm-hmm.
So I would say to you, if you don't want someone telling you what to do and job strain, that's a good motivation. Like I knew it's very hard for me to have a boss. It really is. And when I did, man, particularly when they're stupid, it's just really hard. It's just really hard. And I just would shut up and say, one day, and the truth is you always have a boss. You just can distance yourself. So I have grants. I pay my own salary. So if I have more of that, then yes, I have to answer, but they're self-reliant. So I hope I answered that question. Next.
And what age did you decide you wanted to pursue cardiology?
Oh. Okay. I really didn't, I was influenced by my mother with heart disease.
Yeah, I think you were talking about that before.
Right. But I got to be honest with you, it's like, most of it was like, shit, my parents want me to be a doctor. Okay. And it was like, I want to play at the bitter end. And, what it was that I wanted to be me. And I wound up being me, being a doctor. So I would say it's really, really important to think about who you are. And I wanted to be a big shot, I guess. I knew that I had something to say. I didn't know how I was going to say it. So I don't know if I fit into that category for anybody else. But once I decided to be a doctor, I decided to do it in a certain way that was creative. And I chose cardiology because I just thought it was so funky that it moved and electricity came out and the blood filled. And it was like, whoa, that's wow. And so I did, and I was good at all of it. But I remember I was at Kings County Hospital and I was an intern. I was just like, man, I just love EKGs. I just love reading them. It's just, if I don't become a doctor, I'm going to lose being an expert at that. So, that's a really freaky way to choose a subspecialty.
How do you deal when you were an intern? How do you deal, since you don't like having bosses and people telling you, you do this, you do that, whatever. How did you deal with that when you were an intern?
Because it's temporary. So you have a boss, you're an intern, it's going to be a resident. You have residents who think they're smart because they ask you to do every freaking little thing in working up a cough. And there's others who are reasonable. And the ones they have to do every freaking thing, that means you don't sleep that night. So it's not minor, but you have to shut up and do it. and you learn from that. You learn from restraint. Because you're going up, you're moving up, you get it? So now, yeah, I got a boss, but he's like the chair of medicine and the dean, and there's a lot of other people in between, and I might not agree with them, but that thing about the reputation, you could lose it in a minute. That is mine. That is my thing to bear. That is a burden. So my whole power is based upon my influence on people and persuasion. When I was chief of cardiology, I had FTE. I had actual people I hire and fire. Here it's like, run all the research and get it together and think about the big ideas and get all these people who think they're stars, that they can work together. Man, it's hard, but I do it. I try. But if I was like, Bob Soufer's a liar, Bob Soufer doesn't have a moral compass, it wouldn't work. That job would not work.
Right. Someone asks, advice for high schoolers that want to go to medical school.
Wow, that's a big one, right? I've already answered that, but I don't want to be flippant about it because I think I would go to somebody in the healthcare field and ask them if you can everything about the healthcare field. And in the fall, when it's safe, to shadow them and to look at positions where you can volunteer and see if the atmosphere of a hospital, because you'll see the faces of the nurses, you'll see the doctors, you'll have the smells, and you'll know if you want to do it or not. Well, you're still not sure. It's like I go to the emergency room And these nurses are just like screaming like maniacs. And it's okay. It's like, wow, that's cool. There's a place where people just scream. You know, it's like a different place. But I don't want to be an emergency room doctor. Like, when, you know, you're not going to see it. You're not going to see that clean line between taking care of someone, they get better. It's very hard for you to see that. But doctors are people who have an opportunity to become ennobled, to actually perform one of the kindest things that human beings can do. I remember as a kid, I saw a dolphin movie, right? They have a video. You go to the auditorium, class, 301, go there. And they show these dolphins. And they're actually helping each other. And I'm going like, whoa, that really touched me because the dolphin showed compassion. So, to answer this question about like doctor, it's like, I just was the type of guy that those things were really important to me.
Mm-hmm. Mm-hmm. Mm-hmm.
Yep.
So
I hope I answered that question. Yes.
You did.
And one more question, I think that some people, two more actually. What makes a personal statement powerful for medical schools?
Okay. So, I've read hundreds of them. and I got to say, they generally suck. It's like defensive writing, so you don't say anything wrong, So, usually at the admittance committee, they say, oh, Soufer, put the garbage pail by it, because I just read it, I would just, oh, God, oh, geez, it's like, I would write a thing, empathy, check it off. So, but there were a few, and they started off like, I walk in the room and I see the shadow of the stethoscope, and I thought of X. And it's sort of like they added a narrative. It was really, really interesting. And this person is a great writer. And 12 years later, I hired them, and everybody thinks they're a superficial idiot. But the reason she came is because I know her deepness, because I know what she wrote. And I told her, I remember your essay. And she didn't remember it. So she's one of the best doctors that we have. So I think, yeah, but she can be a phony, it just works that way. But I know she's not really. So it's like being genuine. It's so hard to tell a high school student, who's like never went on a date. Who will I know? Like be genuine. I mean, it's like, it's so BS. But I just telling you, I just can't give you an answer that just, doesn't make any sense. It's like, life is hard. Life is hard, but it's also great. It doesn't mean because it's hard, it's not great. And you have to find out what you love to do. And to do that, you got to get out there in the world. You got to bump into things. That's my advice.
Wow, that was, inspirational.
And one more question. A lot of these are.
I missed one more question. Go ahead.
For now, it's one more question. But what are your views? And I want to make sure that I'm saying this right. Oh, okay. What is your view on BSMD programs?
So is that the combined program?
Yeah.
So I did medical school in college in 5.5 years. And because, I want to go back and play guitar, Bob Dylan. And I freaked out when I saw my first death. I was only like 24 years old. And I don't know if it was a good idea. I think that the advantages of it is that you got it locked in, right? that you can get in. If you're smart enough to get in, you know, I actually went I went to college and got into medical school, a 3-year medical after 2 years of college. But Brown has a combined program. There's very others that have it. And, you know, I think that the program, if it includes in the program the arts and sciences, then certainly that's okay. Go for it. But if it's just going to make you a boring one-dimensional person become a doctor, I wouldn't do it at all. So you have to look at what the emphasis is on it. But I think that, go for it. But if you're too young, if it's 8 years, you won't be too young. But if it's condensed like a 6-year program, you just might be too young.
The medical field is developing in countries. Whoa, no. The medical field in developing countries is struggling, especially with these turbulent times. What can the general population in developed countries like the US do to help?
That's a good question. So at Yale, we had an international global program where, and we'll be back doing it, where we take teams from Yale and do ophthalmology, internal medicine in Dominican Republic, Fuji of all places, Haiti, a lot of Haiti. So there are, but I don't think that's enough. I think it shows that there are good people who are willing to give their time. And I'm talking about doctors like one at the VA. They pay for it themselves. They pay the airfare and they take 2 weeks off and they go down and do it. They come back with a lot of mosquito bites. And so, I just think that, when you're in an academic program at the VA, you're going to find people like that, but the problems are structural. The problems with South America is the Monroe Doctrine with Roosevelt's, walk light, carry a big stick. All the stuff that's been done in Guatemala, it's been done by North America and with Mexico. And Cuba. So when you say, I know that we have someone from Peru in cardiology training, we have somebody from Dominican Republic, and they're the best. And one of them went like to Jamaica Hospital, one of those hospitals that people you'd say, but they worked themselves up into a regular hospital. The world is changing. Now, I think that our administration at Yale spends a lot of time with diversity and equity, but so does Harvard. So does, people are getting it, and the way you know that, because in the United States, everything's about money. So when Black Lives Matter is getting money from corporations at least are making the effort to withhold money. That would never happen in my era, ever. Well, the Republicans were saying that was a big deal, but business would never support because the population wasn't there. They cannot disenfranchise 30 to 40% of the population. That's why I tell you, you don't have to do much, but you have to put up with the personal.
Right.
It's hard. It's really hard. I can't make it nice. I can't, I can't make it better. I just know too much. I can't make it better. I'm sorry, but it will get better. I know it hurts now. I can't make the hurt right now better, but it will get better. Mm-hmm. There's nothing I can say except that you could see who I am and what I think, and that I'm not alone. No. And that there's people that believe in what I'm saying, and that, some of you are in places that are very isolated. I mean, I don't know how my son lives in Tennessee. Like I rib him all the time about it.
Well, we live in Texas, so you get an idea.
That's even more isolating, depending on where you're living. But I what I'm saying is where some people live is very, very difficult. Now, this place I'm living, was built by Italians, but the block is a transitional block, and more than half are Republicans, and they have their hats on and stuff like that. And I got to deal with the people who do shell fishing. I forced myself, and they care what I think. They're not rude to me. I don't like what they say, and when they say things like, well, they didn't say so-and-so was this in the newspaper, I point it out to them. That's what I do. And that's what everybody should do. So when, Debbie comes in, they say, she's shocked. I'm the one who should say, no, sir, she's a doctor. But usually no one says anything. And that has changed. If there are women or anybody of color, the patients, particularly at the VA, wow. They're very, but they don't mean it. Some of them do, but most of them don't.
Mm-hmm. And again, Dr. Soufer, we thank you so much for coming out here. This is the last question now. I know even in the chat they were saying that.
The last one I can do, so go ahead.
But we're just gonna wrap it up now though, but we just want to say thank you so much for coming out here and speaking to us, speaking to all the people that watched, and even in the chat they were saying, thank you so much, and they're really glad that they could get help and advice, especially for those going into, medical school, and even some, gonna be a cardiologist like you. And again, thank you to Gonzalo and the Woodland High School officers for bringing Dr. Soufer to us, and to everyone watching. And we love to have you back for any future shadowing opportunities and mentorship opportunities that we have. And I'll give it to Gonzalo before we stop.
Thank you.
Dr. Soufer, I'm just very glad you came here, and you made the time in your schedule to be here with us and took the time to prepare a whole slideshow. Since I know you're a very, very busy man, the fact that you took and made time in your schedule, it means a lot to every single one of us.
We really appreciate it.
Even though some of them haven't spoken the whole session, it means a lot to them though.
Thank you for all the time commitment and keep on answering our questions on top of another. Thank you so much.
You're welcome, Augustina.
And
so, I just want you to also know that it's bilateral, it's mutual. I'm assuming that other two people don't want to say anything.
Thank you, Dr. Soufer. We appreciate your time for coming in and talking to us.
I didn't mean to embarrass you for I just didn't want to be rude, Like, you say I'm such a cool guy, and then I interrupt two women, right? Two of the remaining women, but I can't tell if you're shy or, So
I'm not shy, and you're amazing. Thank you so much for giving us.
Marlon, I know you're not shy, and I'm
not shy. I just don't want to interrupt.
Well, maybe I'm having an impact, eh? And she's just listening. But
you are 100%.
Well, good. I'm glad. I got to tell you that you got to understand, like for someone like me, I'm in my head all the time. Because and so like for me to be able to talk to young people, you have to understand that it's a whole part of my life that would be absent if I wasn't able to reach out, because you got nothing compared to what I have except the future and a way of finding out who you are, which is such a hard thing to do. But literature and doing things and treating people well is a way of finding out who you are. And for me, it's been a very important experience. Because, at first it's like, oh shit, I got to give this lecture. It's like, I don't know, like it's going to be on YouTube and everything. It's like, yeah, what I got to do, And it's like, I'm very private. I don't have a Facebook account. I don't have an Instagram account. I don't like those people. I don't like the people that run it. And I don't want to give them any money. Mm-hmm. And I don't want to give them any information. So for me, I'm not out. I'm on my professional doximity, and LinkedIn, you know, because they're less hairy, because people got to behave if they want a job or they want to be part of the group. But the ones that are unsubscribed, just people say stuff, you know, they say whatever they want, and I don't like it. So I could have a dialogue like this with people who are interested, that I could help, who have hope. It's hard to be young. It's harder to be young and have nothing. And it's really hard to be young, have nothing, and being treated like shit. So all three things, you know, it's really hard. And I remember that because I was always different. And I never thought that I'd be here to tell people or have people say I'm cool or whatever. I mean, I just not afraid.
They want you to get adopted. They want you to adopt them.
But I ask you to lose, not to be afraid. See, so when people say you're shit, you get afraid. You see? Rosa Parks was not afraid. I'm not afraid.
Right.
You can't be afraid of people. You can't make them afraid. You can't make them put fear in you because they're scared shit. What you're doing now is making yourselves grow because you're putting yourselves out there. You got to put yourself out there. I can't put myself out there on platforms that created evil and lies, and I saw it all coming. And I love this country and I love the world, but what we've done has really screwed people up because we were an example. And now half the people, I mean, Rush Limbaugh got the Medal of Freedom. Are you kidding? He was the beginning of it because after Reagan, he allowed having opinion shows. After Bush 2, they allowed advertising for pharmaceuticals. These things, these little things have changed our lives. Just changed our lives. These little things we let them do. These little things you let them do. You cannot comply with edicts that go against moral behavior and restraint. And, you know, we had no choice. You know, we had no choice. And they deregulated, and there's an income gap. And Fox News, what they do, so usually when there's income disparity, the workers go against the rich people, but now the rich people own the networks and they convince the workers that the people that are good for them are the schmucks. Screwed everything up. So there's combustible anger. And those people got confused with the 30% of haters that will be violent, 20%, 20, 30%, and it grew. And we have to get a retraction. But this was very important for me. I really, really thank you. And, you know, we'll think about this. And I think if I did come back, you know, can't do the same thing, but maybe I'd be just talking to you a bit. Okay?
Yeah, and definitely since you're a professor, it's
not right away, but I will come back. What's that?
Yeah, of course.
Okay. And you could keep in touch with me. All right.
Yeah.
That doesn't mean I'm going to get you in medical school. It just means I can, you know, help you. All right. Yeah, because the thing that's the killer is if you went to someone and said, you know, I want you to look at this application, like if you're at Yale and did that, your name would just be shit. You just can't do anything like that. You just can't do that. So, but there is advice that can narrow things down to give you the best chance to be successful. All right?
Right.
All right.
All right, guys and ladies.
Thank you so much, Dr. Soufer. We'll stay in contact. I appreciate
you.
Okay, I'm going now. Bye.
Thank you.
Thank you.
So much.
Okay. Well,
so
Rohan.
that's the end of the live. Thank you for everyone for attending. Hopefully you guys learned a bit and we tried to answer all the questions. I'm trying to pull up the chat right now. We tried to answer all the questions. and hopefully we can, contact Dr. Soufer. On the form, there is an option if you want to receive emails from us about future shadowing and mentorship opportunities. So you can stay in touch with us. That's a great way. And thank you so much to the Willen High School and you guys for and Gonzalo for bringing bringing the special guest Dr. Soufer to us.
He was pretty special, I'll tell you.
I loved it.
Thank
And
you
I'm a
guys.
shy girl.
Uh,
I didn't know that.